Hi, my name is Beatriz Ortega, and I'm in the final year of the Northern Intellectual Disability Program at the University of Limerick. I would like to share my final research project describing the challenges that adults with intellectual disabilities encounter when accessing healthcare services. First of all, I would like to introduce an overview of what I will cover on this presentation, beginning with a brief introduction of the topic. Following that, I will discuss the methodology used, results that were found, and summarize with a conclusion of the impact of these findings. Finally, I would like to wrap up with some recommendations. I would like to start with a quick definition of what is intellectual disability. This condition is characterized as a significant reduced ability to understand new or complex information and to learn and apply new skills, resulting in a reduced ability to cope independently, which begins before the age of 22. This population have been identified as having a range of complex health problems and chronic health conditions than the general population. Some of the most common health conditions they might experience include gastric aspiration or pneumonia, dysphagia, gastroesophageal reflux disease, epilepsy, or constipation. However, these health needs often go unnoticed and unmet due to their illness not being recognized. Research has outlined high rates of mortality and morbidity due to poor hospital care delivered, with reports of many of these people often dying early due to avoidable causes. This evidences the fact that this population face greater challenges in accessing and using healthcare services than their peers without intellectual disabilities. So the purpose of this research project is to explore the challenges that adults with intellectual disabilities encounter while accessing healthcare services. So I conducted a focus review searching academic journals, which identified through databases such as Sanel Complete Medline with full-text psychoinfo on Scopus. The key terms that I used to find relevant journals to my topic were adults with learning disabilities or intellectual disabilities, barriers or challenges, healthcare and hospital settings. Based on this process, I was able to identify journals relating to nursing, disability, and healthcare topics. Then I searched numerous of journals individually from the period of September 2020 to September 2021 using same keywords as previously used in databases. Journals that weren't published within 12 months were removed, leaving 4 journals as a basic data set. These journals are ranked from the highest to lowest impact factor on the table. Papers for inclusion were required to be only in English language, within the time frame, and related to healthcare studies. Finally, I excluded papers involving children or elderly population, and studies not related to healthcare settings. By conducting research, 8 articles were found as potentially relevant for my topic, which were saved and read in full to define eligibility, although only 4 articles were chosen for the review as they met the criteria. The findings from the chosen studies were mapped systematically to a predefined template. I designed a data extraction table by gathering information from selected papers, including the aim of each article, the year, the country, name of the journal published, and sample characteristics, barriers encountered by participants, and recommendations. This information was relevant to answer the research question, which later was divided into 4 themes. Findings were analyzed and identified as 4 main challenges. Poor communication was found to be the main barrier, as it was noted that some of the healthcare professionals preferred to talk directly to family members while avoiding communication with the patient with an intellectual disability. It was also found that information provided was overly complicated and difficult to understand due to the medical language used. The second main issue was the lack of understanding of the needs of patients with intellectual disabilities, which negatively impacted the quality of care and support provided. This was observed when healthcare workers failed to assess pain management in adults admitted to orthopedics and trauma care, who were experiencing uncontrolled pain. This lack of awareness was also found in the lack of inability to recognize and measure the needs of women requiring breast cancer screenings. Environmental issues was another challenge identified especially in unsuitable healthcare facilities, such as unfriendly wheelchair access, poor signposting, and some buildings lacking elevators. Lack of transportation is another challenge due to the inability to travel longer distances, especially for those who live in remote areas. Last but not least, the final barrier was financial issues, which affects a large number of people that cannot afford specialist services due to the high cost. This population is also disadvantaged financially when compared to the general population due to the low incomes and at high rates of unemployment. These findings clearly show that hostile healthcare professionals are unaware of how to communicate with patients with intellectual disabilities and find it difficult to provide person-centered care. These results also demonstrate a lack of training concerning this population, resulting in a failure to recognize the needs and support they require, such as pain management and the integration of appropriate health check assessments. Environmental aspects also create obstacles for some patients with physical disabilities who are unable to attend their appointments because some healthcare facilities are not wheelchair user friendly. This results in delays for their diagnosis and treatment. The high cost of these services and the lack of funds can also impact access to healthcare services for those with complex health problems. Such challenges need to be addressed so that this group receive healthcare equity and improved healthcare outcomes. This study recommends the use of health passport to aid effective communication and care. This communication tool is fundamental to be introduced before the admission of a patient, which helps hospital healthcare workers to gain an insight into the person's individualized needs and identify their choices and preferences. Secondly, the expansion of the role of the intellectual disability nurse working in acute hospital settings. This expansion aims to meet the needs of patients with intellectual disabilities, implementing reasonable adjustments and improving the quality of care within healthcare settings. Last recommendation is to increase educational training concerning intellectual disability for all healthcare providers. This includes awareness of simplifying language by introducing an easy-to-read document with symbols, photographs, or objects, which enhance the patient's abilities to understand their medical procedures. The findings from this study highlight the most current evidence in this area and will increase the awareness for change in practice and attitude of healthcare providers. Thanks for listening and giving me the opportunity to share my research project. I hope you enjoyed it.